This video is going to serve as my submission for my TPN administration skill. I do not have a dummy or anything to show it on, so I'm going to just verbalize the steps to the best of my ability. So before starting any skill, I would give a knock on the door, introduce myself while performing my hand hygiene, state my name, introduce myself to the patient, and then verify that I have the correct patient using the two identifiers, the first and last name, and their date of birth. Also verifying if they have any allergies. I would describe the purpose for the procedure, stating that we are going to be administering TPN, asking if they understand the purpose of the infusion and what it's for. And if they do not, I would explain that the infusion's purpose is to administer nutrients in through their central line. It would be like serving as food through intravenous, through their IV into the bloodstream. I would need to ensure that this patient had a central line, because TPN can only be administered through a central line, and we would need to make sure that that central line is patent and that it has no issues going on with it. To do that, I would flush it with normal saline. You would cleanse the port, or the end of the little Y port, for 30 seconds, let it dry, flush with normal or check for blood return, flush with normal saline, and then get all of my supplies ready, just to ensure that there was nothing going on with the central line, because if there was something wrong with that, we wouldn't be able to proceed with the rest of the procedure. We would need to ensure that the doctor's order matches with the solutions that we have available, the TPN and any lipids or any additives that we're going to be going into that as well. I would need to verify the orders with 2 additional nurses, just to make sure that it's the correct patient, the correct solutions, and we're putting it in through the correct route at the correct time. After I had done that, I would make sure that we have everything in the room that we would need for TPN administration, such as we would need at least two pumps, 2 separate pumps, one for the TPN and one for the lipids. We would need IV infusion set tubing with the special filter for the TPN. We would also need any alcohol swabs or caps that we were going to use for the central line to clean, and a bag of D10, so that if the TPN solution were to run out before exchanging another bag, the D10 could infuse in its place. After gathering everything and having it in order and in place, and we've had it all verified by 2 nurses, we would begin the procedure, get everything hung and in separate pumps. You would have to connect the lipid tubing below the TPN filter, because the lipids cannot go through the TPN filter because they are too large, and make sure the D10 is in its place as well in the room. Before connecting the patient to the tubing, I would make sure that the tubing is primed and that the line has been flushed, the line is patent, the line has been cleaned or had a chlorhexidine cap on it, or I have cleaned it properly, and that my other IV tubing has stayed sterile, and then it's primed, then we would be able to hook it up to the line there. And now, after we initiate TPN or lipid infusion on a central line, we want to make sure that we don't do any blood draws or anything of that sort in that line anymore. Before administering the lipids, I would have already made sure that there was no separation of the layers of the solution, that there was no accumulations of fat. I want to call it clots, but it's not that word. It's fat globulins, I think it's referred to as, or anything frothy going on with the lipid solution, or else we would not be able to use it. I would make sure that we verified the rate and everything going on with the order and with the 2 other nurses. We would also need to perform AccuChecks or blood glucose checks as ordered by the doctor. Need to make sure that we're not having any spikes in blood sugar, hyperglycemia, monitor for signs and symptoms of that. We would also need to monitor I's and O's, or trend the I's and O's, and make sure that the input is balancing out with the output. We're not having any other complications like infiltration with that type of solution, or air embolus, or any other complications of that sort. I would ask the patient how they're doing, if they're alert and oriented, and I believe that's it. It's kind of hard to visualize all the steps when I don't have something to perform it on here. Before leaving the patient, of course, I would, like I said, observe for all the complications, stay with the patient when the treatment is initiated, check on them frequently after, monitor their blood glucose afterwards as well. And then I would leave them in a safe low bed position with their call light, and tell them to call me if they feel any signs and symptoms of just not feeling well, or having a lot of sudden urine output or anything like that, or chest pain, or any signs of any complications. And then I would leave them with their call light. Of course, I would remove my gloves in a way that I wouldn't contaminate myself. Ensure that I know when the solution is going to be finished and when I need to hang a new bag. And then I would, remove the privacy curtain and then wash my hands. And I think that's it for now. It's the best I can do without someone here. Thank you.